My name is Jamie Giovanna, DSW candidate at Tulane University. This is my proposal for my APP research project, Exploration of the Correlation Between Non-Suicidal Self-Injury and Adverse Experiences in Adolescence. What is the prevalence of sexual and/or physical abuse in adolescents who engage in non-suicidal self-injury? The purpose of this mixed methods study is to explore the prevalence of sexual and/or physical abuse in the biopsychosocial history of adolescents enrolled in mental health services who positively identify non-suicidal self-injury among their symptomatology. Additional information to be explored are other forms of adverse experiences, potential trends in demographics, experiences adjacent to the abuse, such as being believed and supported, other mental health symptoms identified for treatment, and the subject's sense of how well different treatment modalities are helping them. So what is non-suicidal self-injury? This project is operating from the DSM-5 definition of non-suicidal self-injury found on page 923. The target population is adolescents aged 13 to 19 enrolled in mental health services in Washington State. Exclusion criteria is active suicidal ideation with intent and plan, and/or active psychosis. Recruitment for this project, so far I have identified 12 possible research sites to begin outreach to, all of which are less than 100 miles from my home base. This list can be expanded. In Washington State, the age of informed consent is 13. Participation will require signed informed consent from all subjects, as well as parental consent for subjects aged 13 to 17. All forms will follow Tulane University's informed consent guidelines, and all forms will be electronically signed and stored. This is a mixed methods study. The quantitative portion of the study is an anonymous electronic survey to be captured via Qualtrics utilizing a mix of Likert, multiple choice, and yes/no questions. Survey completion time is approximately 30 to 90 minutes. Surveys delivered in person when allowable in groups of 4 to 8. Tablets will be provided by the researcher to control the equipment collecting data. Host facilities will also be given the option to distribute the survey electronically to outpatient participants in the event that in-person delivery is not possible. For the qualitative portion of the study, survey participants will be provided with the option to engage in a confidential interview. Participants will be advised of legal requirements of mandated reporting and duty to warn. There will be a maximum of 10 participants. The interview time will be 60 to 90 minutes, and the interviews will take place one-on-one, either in person or via Zoom. For privacy and confidentiality protections, in-person data collection will be performed in a closed room. All data stored on password-protected devices within locked offices inside of locked buildings. All primary storage devices are Apple products which can be remotely reset to factory settings in the event of theft or loss. All surveys will be administered anonymously and without identifying information, and all interviews will be recorded without identifying information, substituting names with participant numbers. Potential risk to participants. This survey and interview will ask questions pertaining to potentially difficult and/or painful experiences. Some questions may cause emotional distress. Disclosures given by interviewees may result in outside disclosure due to mandated reporting laws and/or duty to warn requirements. For risk mitigation, all participants and parents, when applicable, will be notified of risk of harm at the time of informed consent. Study recruitment restricted to clinical environments only. All participants will be advised of risk of harm before directly engaging in the study. Participants advised they may opt out at any time without adverse consequence. All participants will be encouraged to seek support from program staff, their own therapists, and/or their family. Participants will be provided with local crisis and support line resources. There are no conflicts of interest for this researcher. I am not employed by any of these facilities, and I will not benefit monetarily.